Hello, I'm Elise Spronk. Sorry, I'm kind of flying in here today. And I think we'll just go ahead and get started here in a couple minutes. We technically have 2 more minutes before the 1:15 start time. So we will wait for those 2 minutes and then we will get started. So. All right. So my name is Elise Spronk. I unfortunately can't see who's all with me today, so that's always a bummer. But I'm hoping that we can spend maybe the next 30 minutes or so going through some sensory processing 101. So just give you some basic knowledge of sensory processing, and there will be time at the end that you can ask questions. Unfortunately, those will have to come through the chat or the Q&A on here since I'm not able to hear you. But and if at any point during the presentation you have a question, feel free to ask that. I always would rather people ask those questions right away versus waiting until the end or whatever. So anyway, so let's see here. There we go. Had to figure out how to change my slide. So the first thing that I want to point out about sensory processing is just how foundational it is to all of the rest of our development. And so you can see from this slide, which is a fairly old slide, 1991 is where this pyramid is from. It just shows how all of our sensory systems are right there on the bottom of our developmental pyramid for development. So we ask our kids, what we really hope that they strive and succeed in is their academic learning, their behavior, and their daily living activities. And you'll see those functions at the top of that pyramid. And so that's where we're hoping that things may become easy for our kids and that they do their best and are able to be successful. Below that are all sorts of perceptual motor and sensory motor development skills that need to be in place and fairly automatic for the child so that they aren't using brain space in order to pay attention to that, so that all of their energy and their cognitive abilities can go into that academic learning, daily living, and behavior. The one thing that probably would be changed about this pyramid, looking at certain theories of our development, is that reflex maturity right there in the middle of the pyramid in many models is placed on the bottom or the foundation of the pyramid, just like the sensory system. So oftentimes when we look at a child, we'll get a referral for a kiddo who's having difficulty with behavior, or maybe they're struggling with learning in school. We will always look at the bottom of the pyramid first. So we test reflex maturity and we look at their sensory processing skills and determine first, if these are actual bricks, are there bricks that are out of place for this child? And so what can be done from the very foundation that's going to help make things easier and help that child be more successful. And then obviously we also look at the middle of the pyramid as well. So there are 8 different sensory systems, and the first 5 are the most well-known sensory systems. So hearing, taste, smell, sight, and touch. Those are the ones that we often teach our kids about in grade school, and we often emphasize those specific senses. However, the last three are extremely important and often under-recognized or under-considered when looking at sensory processing. And so vestibular or movement, so that is our brain's ability to detect whether we're moving or whether we're standing still, and really what planes of movement are we moving in? Are we moving in a linear pattern? Are we moving in diagonals? Is our head upside down? That type of thing. The next one is proprioception. And so that is our, we receive a lot of information about our proprioceptive system from our muscles and joints. And it tells us information about our body position. So this is an extremely important sensory system, even when we look at social skills, and I think can often be under-recognized. So when you think about how a child knows how rough to play with another child or how hard to throw the ball at another child, proprioception is what helps them be able to detect that. And so if there is an issue with proprioception, it can often lead to behavior issues, as well as some of those social issues. And then interoception is our ability to be able to detect and read what's happening internally inside our body. So this is the sensory system that tells us, do we have to go to the bathroom? How am I feeling physically? Am I tired? Am I hungry? Do I feel sick? And so again, an extremely important sensory system when we're thinking about behavior and, academics and being able to complete normal daily tasks. So what is sensory processing? So sensory processing is something that happens all day, every day. It is our brain's, the procedure of our brain taking in information from things happening around the world, around us in the world, and from our bodies in order for us to use that in daily life. So, this is happening right now as you're sitting here and listening to me. You're feeling maybe the temperature of the room, maybe the comfort level of the chair that you're sitting on. You are, taking in auditory information, you're taking in visual information, not just from the screen in front of you, but from the lighting around you. And all of that is impacting on whether or not you're able to pay attention and whether or not you're able to be able to focus and learn as we're talking here today. And so, if we think about our kids, you got to choose where you listen to this webinar. Maybe you're in a comfy place in your house. Maybe that wasn't available to you. So maybe, you're in not such a comfortable place, but either way, you got to choose how you wanted to be set up for this webinar. And oftentimes, especially with our school age kids, they aren't necessarily choosing to set up their sensory or the world around them to promote optimal sensory processing and staying alert. So what is sensory processing disorder? And I hesitate to even use that word, but it's one that's often used. And technically, there's not even an actual sensory processing disorder diagnosis. So that's why I hesitate to use it. Yet, oftentimes that's what we hear about, right? So that disorder or disorganization is the result of three different things that may have gone wrong or aren't necessarily working the way they should. The first one is that the brain is not receiving or detecting the message from the sensory input. Okay, so maybe the sensory input isn't strong enough, and so the brain isn't detecting it. Perhaps the brain is inefficient in integrating or organizing, discriminating those sensory messages. So now it received the message, but it's not doing what it should with that message. Therefore, the third thing that can go wrong is that the brain is not sending out accurate messages to direct your body's actions. So, if you think about the simple somewhat simple act of stepping up onto a step. You know, your brain has to receive the information about how far away that step is. It has to then, once it receives that information, it has to organize that information and be able to determine how high up your foot needs to go to step up onto the step. And then you have to get your muscle to contract to get your foot up onto the step. So you can see how, you know, even when we think about, you know, kids who might be clumsy, how their sensory processing could be impacting some of that coordination. Okay. So when we look at sensory processing here in the clinic, I often will have parents complete the sensory profile, and that's a questionnaire, a pretty in-depth questionnaire that just helps us determine a child's sensory preferences. And so there's 4 basic categories on the sensory profile, and sometimes kids will score maybe even in all of the categories. Sometimes they'll maybe only score in 1, and sometimes they don't score in any, but at least it helps us determine where the child's at for their sensory preferences so that we can determine how to best equip that child and best support them. So the first one we're going to talk about is sensation avoiding. So sensation avoiders have a low need for sensory input. I'm going to back up just a hair though, because I want to point out that all of us are somewhere on a continuum. So we either need a lot of sensory input in order for us to respond, or we don't need that much. Okay, and you know, all of us have sensory preferences, and really, when it comes down to it, it's a matter of whether or not we can be functional with those sensory preferences. So that, you know, we always look at this in the context of function. So again, you know, sensation avoiders have a low threshold for sensory input, meaning it does not take much for the sensation avoiders to detect that sensory stimulation. And oftentimes then that threshold can get met pretty quickly. And so then they become uncomfortable. They might get frightened. They may be withdrawing from certain sensory input. They might have an outburst to get out of a situation because they're overstimulated. And so with these kids, we need to gradually broaden their bubble of acceptable sensory experiences, but do that in a safe manner. So we don't ever want to, you know, bombard the system, hoping that that will maybe help. We don't want to increase anxiety while we're helping them adjust and helping them you know, modulate to that sensory input. So these kids often really are resistant to change. They like things to be very familiar. They're pretty rigid on their rituals. And so we want to expand that acceptable within some of those tolerances. And, you know, again, because we don't want to increase their anxiety while we're helping the situation. Sensitivity to stimuli also has low neurological thresholds. These sometimes are called the sensors. And so, again, doesn't take much sensory input for them to notice something. These, the sensors are very, notice maybe the newest thing that comes into the room. So these are the kids who, you know, notice when somebody gets up to go sharpen a pencil, or you know, something that maybe distracts them to take them away from what they're doing. So they're very distractible. They maybe appear hyperactive. And so what we want to do for these kids, again, they don't need more sensory input. They need the right type of sensory input in order to support them to be able to continue what they're doing and not be distracted. So kind of store that up. We're going to talk about what that right sensory input is going to be here in a little bit. Poor registration. So these kids, opposite to the avoiders and the sensors, have a high neurological threshold for sensory input, meaning they need a lot of sensory input in order to respond to something. And if something isn't sensory enough, they are passive in making sure that that happens. And so oftentimes the bystanders is what we call them sometimes, they may appear to have low energy levels, they may appear tired. And so oftentimes they might get kind of a bad rap because they maybe just seem to be kind of apathetic to what's going on around them, but that isn't necessarily the case. They may just not be paying attention because it wasn't sensory enough. And so, you know, what I found is that oftentimes the kids who struggle with poor registration aren't necessarily identified as that until later on, maybe middle elementary years or older, because they haven't had any behavioral issues. These are easygoing kids usually, so nobody really worries about them. And then we start to realize later that they're probably missing some important instruction and some important cues just because it, you know, maybe wasn't a multi-sensory cue, that type of thing. Then there's the sensation seekers. I would say that probably the seekers and the avoiders are the two that get in trouble the most, because both of those two groups are active to either meet their high threshold need, such as the seekers, or to avoid that low threshold. And so the seekers are continuously engaging, they're fidgety, they're very excitable. These might be the kids who, you know, are touching everything, touching other kids, that type of thing. They're the movers and the shakers, and they like things to be different, and they like to, again, have a lot of sensory input. So if that isn't being provided to them, they are going to actively pursue any avenue to get that sensory input. And so sometimes it's unacceptable ways that they achieve that threshold. So modulation, sometimes, like I mentioned, we see kids who score maybe in the sensory seeking for movement, but maybe they score sensory avoiding for sound. And so now we've got, you know, a high threshold and a low threshold score. And so what that can sometimes indicate is that there's a modulation issue. So modulation is our brain's ability to kind of get used to what's happening. So either our brain ramps things up so we pay attention to it, or it filters it down so we don't pay attention to it. You know, if we paid attention to every single auditory input that was happening around us, none of us would be able to pay attention to anything because we'd be paying attention to the furnace fan and, you know, maybe a drip from the sink, you know, those types of things. And so eventually our brain dampens that so that we aren't paying attention to unnecessary things. And that's what modulation is. So self-regulation, this is kind of a big term in the sensory processing world. So, you know, self-regulation is our ability to either attain, maintain, or change our arousal level appropriately for a task or situation. So this is really our ability to either do something to make sure that we're going to be alert and attentive, or our ability to use sensory input in order to calm ourselves if we're anxious or you know, feeling distracted. Okay, so self-regulation is a really important skill to attain, and oftentimes it's something that we work on in therapy so that the child can either be calm or alert depending on the situation and what's needed. So we do that through a program called the ALERT program, and it's a sensory cognitive approach where we teach kids, first of all, how we teach them to recognize their own arousal state. So we use engine terminology, high, low, and just right engines, and we help them identify, first of all, how they're feeling. Once they've been able to successfully identify how they're feeling, then we work on various sensory strategies going through all of those different categories to identify what their own personal strategies are. And a lot of times, you know, we know these things, but we aren't necessarily thinking about them. And so we just want to be able to have those strategies readily available so that, you know, when you're seeing your child has a high engine, your only suggestion doesn't have to be to go run around the house. There's other ways that are better to help with some of that regulation. All right, this is a handout that was developed by Patricia Otter. It's fantastic. And I can email you a copy of this if you need it. This is the sensory motor planning worksheet. And so this is all based off of science and what we know about how our brain processes different sensory input. And so if you look on the left-hand side of your screen, you're going to see taste and smell and oral texture. Those are the two easiest sensory experiences, systems for our brains to process. So if something is easy, we can figure it's calming, correct? So taste and smell, oral texture can be a very calming sensory experience. And if you think about how babies learn how to calm themselves early on in life, one of the first things they do is they learn how to suck on either, a pacifier or a nipple and that oftentimes will calm them, okay? Our mouth stays pretty active with us throughout our lifespan. And oftentimes, even as adults, we maybe have a cup of coffee, which would be the bitter taste. Maybe we, have a crunchy, salty snack in order to keep us alert and focused to finish watching a movie late at night. And so as you move down the column, you're going to go from calming to more alerting, because sour, citrus, spice, bitter, smoke are more difficult for our brains to process. So those tastes are going to be more alerting, okay? The same is true as you go from left to right across the screen. And so taste and smell, the next thing over is tactile, vestibular movement, and vestibular gravity. Those are going to be more alerting, more organizing for our sensory system. So tactile, movement, and gravity are organizing. So when you think about organizing, those are the things that I tell parents. I'm like, if in doubt, go to the organizing, because sometimes you don't really know, is my child seeking behavior or are they avoiding behavior, that type of thing, but they need something. Joint and muscle activity, so deep pressure, heavy touch is usually a good go-to. It's going to be a more organizing neurological experience. You'll see in the very middle of the chart, bouncing and swinging. Those two movements are very organizing for our brains. So, it's when you see kids who could jump on a trampoline forever and it seems to improve their attentiveness or the behavior, or swinging helps, it would be because that's a really good movement type activity. As you move again more toward the right, you're going to see visual and auditory. These are the two sensory systems that are the most difficult for our brains to process. Therefore, they're going to be more alerting. And when you think about where our kids spend much of their time, especially school-aged kids, it's in the visual and the auditory category. They're learning, they're looking at things, they're listening to language all day. And you'll see there that language is in the bottom right corner. Meaning, if we went all the way across and that went from calming to alerting, and top to bottom goes from calming to alerting, language is the most alerting sensory experience that we can participate in. So it makes sense that trying to talk somebody out of a temper tantrum, or trying to talk somebody into paying attention, or talk them into being calm is probably not going to be that successful. If I'm really upset about something and I come home and my husband says to me, "Oh, just calm down, it'll be fine," he's probably not going to get a real good response. But if I go for a walk or take a shower or have a Diet Coke or, listen to some music on my way home, those are all sensory experiences that are going to help release endorphins to my brain. They're going to naturally calm me down more than somebody just trying to talk me into being calm, okay? And so it's, similar to a child who, is literally bouncing off the walls and you tell them, sit still and pay attention. That's not really going to be effective, right? I mean, we all kind of chuckle about that because we know that that doesn't work. But, giving them some of that sensory input that they need is going to be much more effective. And then once they've regulated, they've, have gotten themselves to the right level of attentiveness, then you can talk it through and there can be, perhaps a learning time with them. At the bottom of this chart, you'll see some different variables that we can change. And so, bring up the jumping on a trampoline. So we all know that kiddo who could probably jump for hours, but we don't have hours to give, right? Like we have to get in the car, we got to get going. So they can't jump as long as they want, but you still know that it's good for them. So you can change some of those different variables so that they get the input that they need, but it doesn't take 2 hours. And so, you can guide them and say, you know what, I want you to jump big, big, little, big, big, little. So now you've added some rhythmical input to it. Maybe you tell them, I want you to jump as big as you can for 1 minute. So you've changed the intensity. And now, instead of maybe letting them jump for 2 hours at one time, maybe you change the frequency of that input. So now, they're jumping in the morning before school, they're jumping, on the trampoline when they get home from school, they're jumping, so now you've changed the frequency And, this can be useful for almost any sensory input. So even if we talk about gum, chewing gum, it can be a very organizing sensory experience, but we don't want to chew gum all day. And so if we can't chew gum all day, maybe we can change, the intensity of the gum that we're chewing. So instead of chewing a thin piece of, extra gum, maybe we give the child Bubblicious because now they're using more joint and muscle activity because it's a bigger piece of gum. And so you've changed, the intensity of that input without allowing the child to chew on gum all day. Okay. Hopefully some of that makes sense. So now we're going to get into just some specific ideas for sensory input and some activities. So remember I talked about the organizing sensory categories. So those were those middle 3 columns. So tactile, vestibular, gravity, and vestibular movement. And then it's the middle 2 rows. And so those are organizing input. So, when we think about sound, limiting, all of the sound that's going on around us. So, extraneous auditory input, big fancy words just for environmental noise. So sometimes kids can use like the noise canceling headphones can be helpful. Reducing a loud surprise factor. So this would be especially good for kids who, maybe don't like automatic flushers, don't like alarms, that type of thing. And so reducing that, or at least preparing them like, okay, the toilet's going to flush now. So that way they can prepare themselves. So the linear and oscillating movement. So again, swinging, jumping, all great organizing activities. Salty, crunchy, or spicy, sour, chewy are oral inputs that can be very organizing. And I often think about, what do I go to when I need to be either, woken up or calmed down? And oftentimes those are, some of the types of snacks that I might go to. And then the deep, firm pressure touch. Again, there's science behind all of this, and oftentimes it has to do with the endorphins that released through these activities. So deep, firm pressure touch. Our sense of touch, our skin contains so many amazing receptors that have the ability to release endorphins to our brain. So, you think about kids who love to have their back scratched, or, just, love to have you give them a foot massage or different things like that. You're really doing them a good favor by doing some of that. And so even thinking about big, heavy hugs can be really helpful because of all of the endorphin release that can happen through our skin. Some additional ideas. So, the kids, the sensory avoiders, we talked about how they need a routine and they need a schedule. So, for those kids, outlining the schedule for the day, discussing unexpected events before they occur. Oftentimes, kids will respond really well to singing instead of just talking them through an instruction. So the cleanup or the new game songs can be really helpful. I feel like preschool teachers and kindergarten teachers do an amazing job at these things, and totally know that kids respond better to songs. And so, even as a parent, using some of that when you're at home can be helpful. Limiting a lot of extra visual input. So, visual and auditory is very stimulating. So sometimes we just have too much stuff. And too many things out. So even thinking about, if your child seems to get into the toy room and, it's a disaster every time they're in there, maybe there's just too many things that are visually out. So using cubbies, or maybe even just putting some of the toys in a closet and not, having everything available all at once. Can be helpful. And then for those older kids, using labels and organizing so that, it's just visually kind of all in one place can be helpful. So from a movement standpoint, so, and from our body standpoint, so using breathing before transitions, so many excellent things. That could be its own webinar about breathing, but breathing before and during transitions can be helpful. Marching, so again, you get that joint and muscle activity through marching and wall and chair push-ups, movement breaks, hand fidgets. So, tactile, again, can be a very organizing way for our brains. And so using little hand fidgets, there's also some more to do with that, like with the Babkin reflex and how that can be calming. So, sometimes you'll just have kids who seem like they always just do better if they have something in their hands. And, it could be a sensory need that they have. So, acknowledging that and respecting that can sometimes be a helpful thing for you. So yeah, auditory activities that can be helpful. So these aren't necessarily just in the organizing category, but music can be a good sensory experience to use, and just thinking about, is this a child that needs to be calmed down? If so, you want to use calming music. And when we think about calming music, we think about our resting heart rate is 50 to 70 beats per minute for a child. And so you want the music to mimic that heart rate. And so, looking at music that's a little bit more rhythmical with that slower beat per minute. Using the noise canceling headphones, like I mentioned before. Sometimes instruments can be fun, but sometimes they aren't fun for those kids who are maybe a little more auditorily hypersensitive. So just being aware of that, I can remember bringing my son to the library for a kinder music activity and thought it was going to be the best thing ever. And it was a disaster because there were, 20 preschoolers banging on drums, and some of them liked it and some of them didn't, but just, recognizing that we all have those different sensory preferences, and varying your instruction. So, I mentioned the kindergarten and preschool teachers using songs for so many of those different instructions. And so realizing, that's a good way, but also just varying the tone and pitch of your voice can be helpful for getting kids to be able to pay attention better. Oral activities, so the obvious ones are the bubble gum, drinking through straws. I mentioned Camelback water bottles. I mostly like those because they have the softer mouthpiece that can be bit or sucked on, and it's a little bit bigger. And so that can be sometimes a good one for kids. Using the mouth for different, learning strategies. So I mentioned cotton ball math or alphabet games. So, blowing a cotton ball to different numbers or letters. Again, the mouth is very calming and very organizing. So sometimes it can be a great way to enhance your learning. Tactile activities. So, just realizing that hand fidgets, as I mentioned, can be helpful, those deep pressure hand hugs. Looking at what type of touch you're using. So deep, firm, predictable touch is going to be much more calming and organizing versus light, ticklish, and unpredictable. And I learned a thing recently about tickling. Tickling and pain go to the brain through the same neurological pathway. And so we really want to avoid tickling. And sometimes our kids will ask us, oh, tickle me. But you have to kind of really wonder, do they really want to be tickled, or are they associating that tickling with just touch? Tickling just is much more unpredictable, so it's going to be a lot more alerting. Now, your sensory seekers may benefit from that, but for the most part, kids probably would benefit more from just the deep pressure. Thinking about clothing, clothing can be a hard thing for kids, tolerating different textures and that type of thing. And so, respecting some of that and realizing that even though you think something feels soft, all of us experience sensory input differently. And so, similar to when you walk into a room and you think it smells horrible and the person with you doesn't smell anything. That doesn't mean that the smell doesn't exist. It just means you're experiencing it differently. And so the same can be true for some of these tactile experiences too. Proprioception activities. So, heavy work, anytime you can engage joints and muscles, deep pressure, those are going to be usually really good activities. So, looking at like a crash pad, if you've got a kid who seems to just fall for the sake of falling, give them an appropriate way to do that. So, old mattresses are great crash pads, taking all the pillows and putting those on the floor. Wrestling can be a really good activity. Bottle babies are just like when you take the 2-liter bottles and you fill them with water and glitter and maybe some oil and then tape the 2 mouthpieces together, and you can kind of flip them. They get heavy that way too. Using stretchy bands or exercise tubing. Sometimes we'll put those on the bottom of chairs in order to give kids that input. Fabric tubes, those are just like lycra tunnels. We use those a lot in therapy. Again, gives you some deep pressure as well as giving some resistance when crawling. And then obstacle courses are always fun. You don't need fancy equipment. You can make those at home as well. Balance activities, I've got to keep moving here so we get time for some questions. But yeah, balance and movement activities are always amazing. And just having a variety of different ways for kids to move. So, jumping, swinging, rocking also gives you that linear movement. Spinning would probably be better for those sensory seekers or the low registration kids, because you're going to get a lot of good input, which is great, but not everybody needs that much. So I love it when schools still have opportunities for kids to spin. There's been research that has shown that spinning, the input and the endorphin release that you get from spinning can last 8 hours. So it can be a really awesome way to get some of that movement. Again, obstacle courses. Sometimes kids need to hang upside down and get their head into a different position. So even doing different songs and movement where, they're reaching down to the floor and getting their head into different positions can be good. So different vision and sight activities. So I think really for this one, it's thinking about what does the room look like? And so sometimes there's too much on the walls and too much visual input. So, acknowledging that, maybe taking some of it away, but also realizing, the lighting can be an issue for some kids. So looking at that, And if there's an ability to have maybe a calming tent or someplace to just kind of get away from some of all of the visual input, that can be a nice little, calming break as well for kids. And then removing some of the visual information from the paper. So, one of the suggestions I've made before, like if a math paper has, all sorts of math problems on it and the child seems to be overwhelmed, taking another piece of paper just with a box cut out and, so that they can see just the one math problem at a time can, sometimes improve their tolerance for that so they don't get so overwhelmed. These are just some of the things we do with our occupational therapy. So again, it comes back to function. So I'll get asked oftentimes, well, how do you know if, my child needs occupational therapy? Well, if a child's sensory preferences are so intense or so strong that it's keeping them from being able to participate in activities with their friends, or it's impacting their ability to learn, if we're seeing, behavior issues, that type of thing, then, again, it's foundational to all of development. So, I feel like it can be a really good place to go and to start when you're seeing some of those issues up at the top. So. And then ultimately we have to all just live under one roof. This is a really, really old family picture of mine. The oldest kid there is graduating from high school in a few months. And so anyway, but you look at your family unit and you realize, what, there might be, all of us might have different sensory preferences if we took that sensory profile. And so how do you make everybody happy? Not everybody's going to be happy all at once, but I think even there can just be a lot of benefit in understanding one another. And so being able to look at different quirky little things and realize, oh, that's because he's an avoider, or and it just brings a little bit of hope to the fact that what, it's okay. We can all function together and work together. So this is my email address. So if you have questions or comments that you don't want to ask today, you can email me, Elise S at kineticedgept.com. And then I wanted to offer a free screen opportunity. So this is a QR code that you can scan and get in touch. We do free screens. We have pediatric OTs in Ames, Des Moines, Newton, Pella, and Oskaloosa. And so if any of this resonates with you today and you think, I'm curious, is this something that could be helpful for us? The free screen opportunity is an excellent way to explore that more. So, all right, any questions that arose through the presentation here? Again, you can use the little chat box or the QA box if you move your cursor over. It's a good way to ask questions.